So we have this Willowbrook study. Started in the 1950s. So Willowbrook was an institution for mentally challenged children. And at that time in the 50s and 60s, when families had a mentally challenged child, the thing to do was to put these individuals in an institution. However, hepatitis used to be a major problem at Willowbrook because of the unsanitary conditions that the children lived in, and they were all coming down with hepatitis. So the institution asked this researcher, Dr. Saul Krugman, to investigate and see if he could try to find some kind of vaccine or drug to help with the hepatitis problem. So he did a series of research studies, and he proposed, one of his research studies was to do a controlled trial using gamma globulin, which he thought would protect against the hepatitis virus, and he would then inject or give hepatitis virus to half of the children enrolled in the research, and the other half would just get placebo, or would just get the gamma globulin and no hepatitis. Okay. So this was a human challenge study, similar to what I was talking about previously about the coronavirus. People are considering about a human challenge study there as well. Okay, so what do people think about this study? What are the major ethical issues, if there are any major ethical issues? So what would a IRB, or a Research Ethics Committee, would ask of the investigator about this research?
So I think it's unethical because it's conditioned. So people who participate in this would benefit from the facility.
I'm sorry, I didn't hear. It's unethical because of what?
It's unethical because it's stated that people who participated in this. Can you hear me well?
Yes.
Is that correct? Hello?
Yes. Yes. Go ahead. I hear you.
Yeah, I can't hear you well.
We can hear you, Mama.
Okay, so I can hear you now. Yeah, so I think it's unethical because it's like was conditioned that people.
It's what?
It's because it's stated that children to participate in the study often guaranteed acceptance into the overcrowded facility. So
Wait,
it's
now,
not.
Okay, let me just. All right, it's unethical because of what?
Because of many points, but the first point is that it's stated that the children participating in this study guaranteed acceptance in the overcrowded facility. So this, like...
No, time out for a second. Well, one, the overcrowded facility has nothing to do with the research. And just to make sure we're all on the same page, I mean, essentially, you have the facility, and all the institutionalized children would be in the facility, and they're getting hepatitis. And the children involved in the research would be in a separate facility that was clean and not exposed to other children with the hepatitis virus.
So
So,
I think I didn't get the point. I got the point that they seek accept the facility, and this will be guaranteed if they accept the permission to be part of the study.
okay, I mean, these are children who are proposing,
I think I get.
yeah? Who's talking? What?
I think what I want to say that it's like blackmailing. In order for you to get into the facility, you have to participate.
Yeah, that's what I got.
Well, why is that blackmailing?
Because for you to get into the facility, to get placed there, you have to accept to participate in the study. So if someone doesn't want to participate, you're not allowed to get into the facility.
Okay, well, I mean, what's the concern with that? The parents could always say no.
Maybe because this is a vulnerable group and the parents would need their children to be accepted in the facility, maybe.
Can I say something?
Yes.
I think that's a violation of the autonomy. They didn't give them the choice for that. They are vulnerable group, but their parents needed to have them in the facility, even though the facility was like low in hygiene and everything else. So I think the first thing that has to be said is like there was violation of this vulnerable group of mentally disabled children welfare and rights.
Well, but the
Can I add something?
I mean, the parents could always say no. I mean, the institution was full, overcrowded.
Okay, can I add something?
Yeah, well, let me just finish this point. It was unsanitary condition. It was overcrowded. It was closed. But they said to the parents, here's the offer. The facility is closed, but we have a separate facility for research, and it's your choice. If you want your child in this facility, the only openings we have are for research studies, and it's your choice. Okay, you know.
So this is the pressure point.
What's that?
So this is the pressure point. So either to be in the waiting list for the unsanitary facility, or to participate in the research, to be a part of a more clean area or more clean facility.
All right, so what's wrong with that?
Because if they didn't participate in the studies, they will be denied the service. They will not get the service. So it's like the penicillin issue in the syphilis study. They are denied the treatment. So here the same.
No, well, first of all, there's no treatment.
Second
of all, the facility was closed.
Okay, can I add something?
Yes, please do, because I'm not understanding the concern.
Okay, I think first of all, they shouldn't have done this research on impaired children who are mentally impaired, and due to the circumstances and the conditions of that institution and the environment, the consent form that they presented to the parents are not, I think, valid, because it doesn't have the necessary criteria. It is not voluntary. They are not given options, so they have no choice.
Oh, wait. Okay. First of all, you're saying several things. So let's take them one by one. Okay. Now, I'll go backwards. The last thing you said was they had no choice. What are you talking about? They had a choice. The parents could say yes or no, right?
Yes,
The
but there is no
facility was
other
closed,
Mhm.
so the parents could say yes or no.
Yeah, can I
No,
interrupt
because
for a
there is
second
no
and say
other
something?
institution. There is no other institution
I know,
for
but
those children.
that's not, I mean, that's not the fault of the researchers.
Can I say something, please?
Please do, because I'm still not understanding
They
the
were
concern.
deceived.
What's
Yeah.
that?
They were deceived that this will
Deceived?
guarantee, deceived, yes.
What do you
That-
mean? How are they deceived?
That they said that this will result in vaccination for treating a very important disease, but this disease is not specific to these children, and such experiments shouldn't be done on these children.
Oh, okay. Now,
When there are
okay,
healthy
so
ones.
again, let's let's focus on that point. Okay. Now, the issue about informed consent, I agree with you. The consent form was a little sketchy. Okay, and the IRB would say, okay, let's start filling in the blanks and start talking more about the informed consent. All right, done. Parents have a choice. They could say yes or no.
Can I say something?
Hold on, let me finish my thought. And so, all right, let's fix up the informed consent. I agree 100%. Now, so before I get to the other point, who wanted to say something?
Sausa?
Yes.
Yeah, in the consent, it said this may give to the children immunity against this disease for life. So maybe it was, really sketchy informed consent, but in the same times they offer something for the children.
Oh yeah, so what's wrong with that?
Nothing actually wrong with that. I totally agree with Golana and Maha for trying to deceive the parents to agree to sign the informed consent. So they are guaranteed the vulnerable. They are guaranteeing that the vulnerable children will have immunity for life. They didn't mention in the informed consent anything about infecting them from the beginning. They said no attack or mild attack, but they didn't explain everything. The informed consent.
Hold
to the
on.
parents.
Oh, hold on. Relax. So the informed consent, virus is introduced, and so either no attack or a mild attack. So an IRB may question, how do you know it's going to be a mild attack? Yeah. Okay. This may give immunity for life. May. It's not guaranteeing 100%. Yes. Now, the IRB may say, well, what is the percentage? How many? And we'll get immunity, and sometimes you just don't know. In the coronavirus vaccine studies, they're not going to be able to know how long immunity will last. Okay. And so, right. So they're not guaranteeing it for life. They say it may. I don't know what may means. Could be, 20% will gain immunity. Okay. So they do say will be introduced. They say a mild attack, but what do you mean by a mild attack? Okay. We would like to give your child this new form of prevention with the hope that it will afford protection. Okay. So the consent form is talking about purpose.
false
Okay.
hope.
It's a little
Giving
sketchy
false
on the
hope.
risks. Mild attack. The benefits, well, afford protection. Maybe yes, maybe not.
And they haven't mentioned specifically the side effects, that they will have vomiting, they will have,
Okay, right. They need more risks. Okay.
and they are giving false hope.
Well, false hope. What about cancer studies? Phase 1 cancer studies. False hope?
No, it's not false hope. It's because if you actually have no hope, then
Yeah,
1%
they have
is
no hope. So what's wrong with false hope? What's wrong with optimism? It's not false hope. Why is it hope?
I think this will
Hope is
persuade
never
them.
something. Hope is never false. Well, let's.
Yes, if you are not certain about something.
Yes, well, you're never certain with research. There's nothing certain about research. All the benefits are potential in research. And if a person will say, if you tell a person there's a 5% chance you'll get a benefit, if the participant wants to say, I'm going to be that 5%, that's their problem.
Yes.
I told you 5%. Okay.
Yes.
If you want to be optimistic, okay, then that's your problem. Okay. I can't be responsible for how you hope. All right. Okay.
Yes.
Now let's get to the important issue here about the. Oh, here we go. Oh. Yeah, I just found my eraser. Okay, I told you I'm learning. All right, so the question is, was this the group to do it on? The children in the institution? That, I think, is the most important question. Was this, could they have, I mean, the children was being affected by this illness, a hepatitis, in this institution. This is why the researchers were brought in. Help us with this problem. It's all over the institution. Okay. So the issue is, the issue about vulnerability is that if one could do it in a group, perform the research in a less vulnerable group.
You should do it on that group.
That's right. So what are the options here? I mean, it's a vulnerable group. You have parents. Maybe the parents are a little sketchy. Okay. But we'll save that for another day. So what other group? What other group would you suggest? Who would you do it on?
Start with adults, I think.
Okay, good. Well, yeah, if you could do it in adults, then you do it in adults. Which adults would you do?
Mentally fit.
Okay, but now, so what I'm thinking about is so I guess it would be similar to the what's happening now with the coronavirus, right? They're asking human volunteers to be purposefully infected with the virus.
Mm-hmm.
Is that right?
No.
No? Wait.
Because
Why not?
Because we said do no harm.
That's well, research always involve harm. I know I showed you the slide that says do no harm, but I think I also said in research there's always risk, so you always want to minimize the risks. There is no such thing as a research study without harms. There's always potential harms. There's always risks. You want to minimize the risk. Okay.
I think these two are
So I'm
essentially
saying don't do any study that involves purposefully infecting people with the illness. That may be a subject for a longer discussion, but that's what's being considered. In fact, they've done human challenge studies for years under certain conditions. They've done human challenge studies with cholera, with malaria. They've done human challenge studies with influenza virus. So they do human challenge studies. So the issue is, could they have done it in another group, which I think is a great question. And
Animal studies?
What's that?
Animal studies? Animals? Before human?
Well, I mean,
animal studies?
well, the question is, you could do animal studies looking at the safety of the vaccine, but animal studies will not be sufficient to determine the efficacy of the vaccine. Okay? When push comes to shove, you got to do it in humans.
Maybe cell cultures of humans?
What's that?
Maybe cell cultures of humans?
I'm sorry?
Cell culture?
I'm sorry?
Cell culture.
Oh, cell cultures. At the end of the day, that will not predict the efficacy of the vaccine.
Yeah, but they didn't mention the vaccine at all. They
Yes.
to see the symptoms. They didn't say that they're gonna offer the cure for the infected children. The main
They said that they were injected antibodies.
Yeah, they're going to give gamma globulin.
But that, I think, was a trial to discover that if it's gonna work or not. They are not for sure, 100% sure.
Well,
that it's gonna work.
no one is ever % sure.
I think first they should minimize the risks and try to have like risk-benefit ratio by enhancing the benefits that the risks are optimal. So
Well,
like
but the basic question is, I agree with all that, but the basic question is, should they have done it in adults? All right, and which I think is the most important question about this study with vulnerable groups. Could they have done it in a less vulnerable group? And I think on one hand, the short answer could have been yes. They could have done it in adults. Okay. The other thing is that could they have done it a field experiment, meaning just give the gamma globulin to everyone in the institution and to see who comes down with hepatitis without purposefully infecting people, because that's the discussion now with the vaccine for coronavirus. Do you just give the vaccine to people and observe their natural exposure to the vaccine without purposefully infecting them? But a lot of people saying that's gonna take a long time, and we need a vaccine now. So the purpose of a human challenge study is to have it develop a vaccine sooner. The other researcher Krugman said, well, we know in children they only get a mild infection if we inject the vaccine, whereas adults, they may have a stronger reaction against the vaccine, and that would be one reason why to do it in children.
Yeah, but can I say something?
Yes.
They didn't do any pre-assessment test or survey on the children that they already occupying the school to know who's infected and who's not, who's carrier
No,
or
they've
not,
done all that.
who's having hepatitis A or B.
No, they did all that. They did all that. They did all that. They did the epidemiologic studies. So they did all that, and they determined that there was hepatitis A and hepatitis B. So, well, let me not continue to belabor the point. Let me just say that this has been a very controversial study for sure. It involved, vulnerable children. And again, I think the important thing is whether they could have done it in adults and in a safe way. So what finally happened was that they, did develop a vaccine. The study proved to be very important, though just because the study gave important information does not necessarily justify the ethics. And I think I think the big question is, could they have done it in adults? And that's the major question. A lot of issues about the informed consent, no doubt about it. A lot of issues about whether all the risks were minimized. In terms of the informed consent, the issue was whether that was offering a space in the institution. We're going to hear more about this. Whether that was what we are called an undue inducement. I mean, they were giving a benefit to the children. It's just like when patients enroll in clinical trials to have access to medicines, and whether that's an undue inducement. We're talking about challenge studies in humans for coronavirus. And they're offering the healthy human volunteers for the human challenge studies, they're offering them $5,000. Question is that an undue inducement? It's not exploitation. Rather, is that an undue inducement, meaning that the price, the incentive is so much to the point where do the participants really understand what they're getting into? Now, some people say, and studies have shown that when you offer a participant a large amount of money to join a study, the participants actually say, oh, this is a lot of money. It must be risky. And so the concern with undue inducement is whether the participant understand the risks of the study. And so that was one concern about the informed consent, whether that constituted an undue inducement, that the parents will say yes to anything. Okay, and so that was a concern. The biggest concern, and let me end on this point, the biggest concern was that this was a social issue, unsanitary institutions. And the biggest social problem was why did society allow these institutions to exist? Unsanitary conditions. That is the larger society concern, was why did they allow such institutions to exist? That's another question for a longer discussion.
Yeah. Professor?
Yes, one. Final thoughts? Yes.
I mean, if we accepted the fact that the researchers have nothing to do, that this facility is full and they will provide a new facility with better condition, so why would we blame them for the presence of the unsanitary facilities from the start? Did you get my point?
I'm not saying, no, a good question. I'm not blaming the investigators. I'm blaming society.
Yeah, but this has nothing to do with the researchers, right?
Right. It has nothing. Absolutely. I'm just adding another point of view that a lot of people were saying. Just like in prisons, a lot of people say prisons are in very bad conditions.
Mm.
And to the point where, you know, after World War II, a lot of phase 1 studies were done on prisoners.
Mm.
In fact, drug companies had their phase 1 testing sites in the prisons. And they enrolled prisoners. And society thought that was okay. And then in the 60s and the 70s, people in society realized the horrific conditions in the prisons. And they were saying, hey, you can't do research on prisoners. Of course they're going to say yes. Because when they say yes, they go to a separate facility. And so that's almost like a separate situation. And finally, they told the drug companies to take their phase 1 studies outside of the prisons. Okay. And so what did the drug companies do instead? They started to do research on college students, offering them a lot of money. Okay. And so, and the drug companies also started, and let me say this last point, and I'll give you a break. The drug companies then started to say, we're going to start going to international countries to do our research. Okay? And because we're going to find a lot of people who don't have access to drugs, and will do research in the developing world.
Excuse me, can I
Yes.
say one other thing?
Yes.
I think Maha mentioned about this is not researchers' responsibility, but this is one big part of research that we said in research, the integrity and dignity and respect to human beings should be it should increase, and doing research in such condition is eliminating that factor, right?
Well, I mean, I agree with you. One could say that's part of responsible science, social responsibility, which actually was on that previous slide.
Yes.
And nobody even touched that. But yeah, you were all concerned about honesty.
Yes.
And integrity. Yes. Nobody put down social responsibility.
Yes, you are right. I've read this article, What Makes Clinical Research Ethical, but the previous version, I don't know which one is when the recent one has been published, which added this last item.
Yeah, it was a couple of years after that. Community perspective.
Okay.
Right. Yeah.
So just to verify a point, so I didn't mean that it's not the responsibility. I mean, if we didn't blame the researchers for taking people who accepted the participation in the study, so we should not blame them for the presence of the unsanitary facility.
Yeah,
Did
right.
you get my point?
Right.
I mean, I believe it's responsibility for science and
right.
like society should be in a better way. But I just want to verify this point.
Okay, good, great. So let's take a break.